Obesity, a serious health problem. Some say that you are what you eat. But is this really true? Suppose you live in a city. You are lying on the sofa with some friends watching TV, and you get hungry. You'll have to choose hamburger or salad, fizzy drink or glass of water, apple or a biscuit. I bet there are times when you've had the hamburger, fizzy drink and biscuit. Not a problem if you only make these unhealthy choices once in a while, but a big problem if it's nearly every day. Obesity is a major health hazard and is associated with a long list of diseases, including heart disease, type 2 diabetes, and certain types of cancer. Obese children are likely to be obese into adulthood, and obese adults are about 6 times more likely to develop type 2 diabetes. Obesity is commonly defined using the Body Mass Index, BMI, a simple measure that is calculated by dividing a person's weight in kilograms by the square of their height in meters. A person with a BMI of 30 kilograms meters squared or more is classed as obese. But BMI does not always tell us enough about body fat. Doctors may also look at how much body fat there is around the middle of the body by measuring the waist-to-hip ratio. Some people tend to put on weight around the middle of their body. This has been linked to a higher risk of future health problems. Worldwide obesity has more than doubled since 1980. According to the World Health Organization, WHO, in 2008, 1.6 billion adults aged 20 and older were overweight. Of these, over 200 million men and nearly 300 million women were obese. Nearly 43 million children under the age of 5 were overweight in 2010. Obesity is preventable, says the WHO. So why are millions of people obese? Many different factors play a role in causing this disease. What you eat and how much exercise you do may have a significant impact on your weight. But this is not the full story. Obesity tends to run in families. This indicates a genetic link, but it is difficult to know if a family is sharing obesity genes or just sharing similar patterns of unhealthy behavior. Luckily, twin studies have helped to solve this problem. Identical twins share the same genes, but non-identical twins don't. Genes are regions of our DNA that regulate how our bodies capture, store, and release energy from food. Researchers have found that identical twins are more likely than non-identical twins to have similar BMI and waist measurements. This evidence suggests a significant genetic component to obesity. Obesity genes also control our eating behaviors and how much satisfaction we get from food. We all have chemical marks in our DNA that can switch genes on and off without changing the DNA sequence. Epigenetics is an emerging area of science that is uncovering the links between these chemical switches, our genes, and the environment they function in. This research is providing exciting insights into the causes of obesity. A number of environmental triggers such as diet, stress, and exposure to drugs and toxins lead to epigenetic changes. Recent studies have shown that a woman's diet during pregnancy can change how her child's DNA functions and may increase their risk of obesity later in life. Scientists and doctors hope that a better understanding of how our body regulates our energy balance and eating patterns will lead to improved treatment approaches and drug therapies in the future. If you eat a balanced diet and exercise regularly, you are less likely to become overweight. But it isn't always easy to make healthy lifestyle choices. There has been a dramatic increase in the production of cheap, high-energy foods that can be transported to our homes and around the world. Our daily lives involve fewer opportunities for physical activity than in the past, and we are constantly exposed to the marketing, advertising, and other pressures to buy calorie-rich foods. These factors are thought to underlie the rapid increase in obesity rates worldwide. 65% of the world's population live in countries where overweight and obesity kills more people than underweight.
Finding out you have diabetes can be scary, but don't panic. People with diabetes can live long, healthy lives. Sure, let's go over some basics. This is diabetes. Made simple. When we eat, food travels to the stomach. Food is made up of 3 basic nutrients: carbohydrates, proteins, and fats. During digestion, carbohydrates are broken down into sugar, otherwise known as glucose. Here's a quick fact. Carbohydrates include foods such as bread, rice, pasta, potatoes, fruit, milk, and yogurt. In a normal digestive process, sugar travels from the stomach, through the bloodstream, to your body's muscle and fat cells. However, sugar can't enter these cells without the help of a special hormone called insulin, which is produced by the pancreas. Insulin acts like a key, unlocking the doors to the muscle and fat cells and allowing the sugar to enter. The cells then use this sugar as fuel to provide energy for the body. When this process is functioning properly, sugar entering the bloodstream from the stomach is able to exit the bloodstream at the muscle and fat cells. In this manner, the body is able to regulate the concentration of sugar in the bloodstream. Now let's see what happens in a person with diabetes. Sugar enters the bloodstream, but one of 2 things happens. Either the pancreas does not produce a sufficient quantity of insulin to match the sugar entering the bloodstream, or the body cells do not respond to the insulin that the body is producing. In both cases, the result is the same. Cell doors remain closed, causing sugar to get backed up in the bloodstream. As a result, blood sugar levels rise. This creates several problems. Because sugars are not able to enter your body's cells, your body is not getting the fuel it needs. As a result, you may feel tired or fatigued. Your body may try to dilute the excess sugar in the bloodstream by pulling fluid out of your cells. This can leave you feeling dehydrated and thirsty. Most importantly, over time, exposure to high blood sugar levels can cause damage to vital organs connected to the bloodstream, such as your eyes, kidneys, nerves, and heart. If not controlled properly, diabetes can lead to serious complications, such as blindness, amputation, kidney failure, heart attack, and stroke. In order to avoid these complications, people with diabetes must take steps to keep their blood sugar levels in a normal range. One way to do this is through diet. By reducing the amount of carbohydrates you eat in a single meal or snack, you can regulate the amount of sugar entering the bloodstream and prevent your body's insulin supply from becoming overwhelmed. This may mean limiting high-sugar foods such as cake, pie, candy, and soda. You know which ones. Another way to regulate blood sugar is through exercise. Physical activity makes your body's muscle and fat cells more receptive to insulin. In other words, those muscle and fat cells that wouldn't open before, now they will. Finally, your doctor may prescribe oral medications to increase your supply of insulin, regulate the amount of sugar entering the bloodstream, or make your body's cells more receptive to the insulin your body is producing. In some cases, insulin shots may also be necessary. Okay, let's review. We've talked about what diabetes is, a condition where either the body does not produce enough insulin, or the body cells are not receptive to the insulin being produced. We've seen what complications can arise from it, such as fatigue, dehydration, and damage to vital organs. Finally, we've discussed ways to manage it through diet, exercise, and medication. For more information about your specific health diagnosis and treatment plan, please talk to your doctor.
Coronary artery disease. Coronary artery disease occurs when the coronary arteries are narrowed or blocked, reducing the amount of oxygen delivered to the heart. 2 conditions, atherosclerosis and arteriosclerosis, commonly cause the narrowing or blockage of arteries. Atherosclerosis is a buildup of fatty deposits on the inner walls of arteries. This buildup causes a narrowing of the inner vessel diameter, restricting blood flow. Fats and other particles combine to form plaque. Arteriosclerosis is a stiffening or hardening of the artery wall resulting from calcium deposits. Often called hardening of the arteries, this condition causes the loss of elasticity, changing blood flow and increasing blood pressure. These conditions can facilitate rough surfaces, making them vulnerable to blockages. A large thrombus can cause an occlusion, or it may break loose to become an embolism and form blockages elsewhere. When blockage occurs, tissues may die, and in certain cases, this can be fatal.
What happened was I used to have headaches, constant headaches and all that. So I went to see a doctor, and they checked me and they found that I had high blood pressure.
I also don't know why I get hypertension, but one day when I was on medical checkup, and the doctor told me that I have hypertension. You see, my blood pressure is very high.
It was those occasional visits to the clinic whenever I fell sick, and when the doctor took my blood pressure, the readings were exceptionally high. So I was very worried as to whether it was just a one-time, reading. And after that, when I continued to take my readings, it still continued to register those kind of high readings. Yeah, that was where my concern started.
Well, for a start, it was sort of depressing. I think that you have high blood pressure. Never knew of high blood pressure until I was told that I had high blood pressure. I had never heard of it before. So I had to change my lifestyle. The doctor advised on the foods I should take, a diet and so forth.
In a way, I wasn't surprised because of the lifestyle that I was living. I would have expected something to happen, but I did not expect it to happen so soon. So I tried to go on a strict diet. I took up more time to exercise, but unfortunately that did not help to bring down these readings.
Then they diagnosed it and then asked me our medication for a few years. So I was thinking, well, I take medication for what purposes? You see? So he said to control your blood pressure so that your blood pressure don't shoot up too high and you might get stroke, you see.
I think one of the causes of hypertension, I think, is salt intake. So I tend to reduce salt in my cooking.
Oh, my advice on hypertension, take less salt, sodium. That's more important.
And of course, I think that's another thing is like he likes those preserved dried fruits, which is actually very salty.
Yeah.
So I would try not to buy, because if it's around in the house, he'll probably take it as well. See. Yeah, so I think most of the time he will probably finish it.
But I had to control my diet and cut out some of the fatty foods and so forth. Yeah.
And now I'm taking off my medication, so I need to do exercise. That's where I go back to the gyms, doing all the exercise that maintain my pressure.
Regular exercise is probably one of the biggest factor that will influence your hypertension readings, and also weight control. I think if you exercise regularly, and if you can bring your weight down to an ideal level, I think that should also bring down your hypertension level.